Thousands of people are diagnosed with cancer every year. If you or a loved one are among them, you are not alone. Having a better understanding of cancer and its treatment can help you be better prepared for what to expect in the coming months. The human body is made up of millions of tiny building blocks called cells. Normal healthy cells grow and divide in an orderly manner so that growth and repair of body tissue can take place. However, cell division may go wrong at times to produce abnormal cells which grow and multiply uncontrollably to form a tumor that possesses the ability to invade and spread to other parts of the body. Such cells are termed as cancer cells. There are many available treatments for cancer. Depending on the type of cancer, its extent, stage, and your overall health, your doctor may have recommended chemotherapy. Chemotherapy uses a drug or a combination of drugs to fight cancer cells. Chemotherapy drugs interfere with the growth and spread of rapidly dividing cancer cells. Depending on the type of cancer and its stage, the chemotherapy treatment may also be combined with surgery, radiation therapy, and other treatments. The goal of chemotherapy is usually to improve your chances of survival by curing, controlling, and relieving the symptoms caused by the cancer. It may be given through various mediums, such as injecting into a vein with a syringe or as an infusion drip, injecting into the muscle or under the skin or spinal cord, taken orally in tablet or capsule form, or through a catheter into the chest or bladder.
The type of chemotherapy treatment used and the duration of the entire treatment is dependent on the type of cancer, the goals of treatment, the drugs used, your response of the cancer cells, and the side effects. During the visit with your doctor, the doctor will review your symptoms and side effects, perform an examination, and review test results. You will also have an opportunity to ask questions. Chemotherapy is often given in cycles that ranges between daily, weekly, or monthly cycles, depending on the regimen you are on. This allows normal cells to recover and your body to regain its strength. Generally, chemotherapy is given in the outpatient clinic. However, you may need to stay in the hospital if your doctor feels that it is necessary to closely monitor your body's response to chemotherapy. Some chemotherapy regimens may take many hours, as the drugs need to be infused continuously for 2 to 5 days or longer. This can be done as an inpatient or outpatient. It is very important to keep to the chemotherapy schedule prescribed for you by the doctor. Missing or delaying your chemotherapy may affect the effectiveness of the chemotherapy regimen.
Chemotherapy is often linked to many side effects because cancer cells grow and reproduce rapidly, and chemotherapy acts by killing these rapidly growing cells. However, the bone marrow cells, cells in the digestive tract, hair follicles, and the reproductive system are most likely to be affected by chemotherapy. Most side effects are only temporary and will gradually disappear once treatment ends. However, the time taken to recover from these side effects varies from person to person. The more common side effects you may experience are fever, infection, and hair loss, which can all be minimized or prevented through the help of medication.
Chemotherapy can reduce the number of white blood cells which your body produces, making you more susceptible to infections. Common illness such as fever, cough, and cold may become severe. It is very important to practice good personal hygiene and take extra care. You can lower your risk of bacterial infections by avoiding crowded places and contact with people who have cough, cold, and other infections. Avoid consumption of raw or undercooked food such as sashimi. Try to also avoid contact with fresh flower and plants as well as animal litter boxes or waste. Be sure to inform your doctor or nurse if your temperature reaches 38 degrees Celsius or if you experience a sore mouth or throat, redness or swelling on any part of your body, or pain at the site of an intravenous catheter or central line. You may feel nausea or experience vomiting during or after each session. Your doctor may prescribe anti-vomiting tablets to control or lessen the nausea and vomiting. Try eating small meals at frequent intervals rather than large meals. Take light meals such as porridge or soup and avoid oily, fried and spicy food. Sour candy and pickles may help too. If you experience nausea and vomiting for over a few days, or if it affects your daily activities, be sure to inform your doctor or nurse. Some chemotherapy drugs causes sores in the mouth and throat. These sores may be painful and may become infected. It is important to have good mouth care to keep your mouth and throat clean. Brush your teeth twice a day with a soft toothbrush and rinse your mouth with salt water or alcohol-free mouthwash after each meal. If you have dentures, be sure to remove and brush your dentures before your mouth care. Soak your dentures in an effervescent denture cleanser for several minutes and don't wear your dentures at night. Fatigue is very common among people on chemotherapy. You may feel tired after the sessions, and this may get in the way of your daily activities. Stay as active as you can. Drink plenty of fluids and eat nutritious foods. Many a time, chemotherapy is associated with hair loss. Chemotherapy can weaken the hair follicles and cause the hair to fall out from all parts of the body much more quickly than usual. However, not all chemotherapy drugs will induce hair loss, and most of the time, hair loss is only temporary. Typically, hair loss occurs 10 to 21 days after the first cycle of chemotherapy, and it usually begins with the hair loss on the head, although you may experience hair loss on other parts of the body as well. Hair regrowth may begin during the course of chemotherapy, although it may take a slightly longer time. Try to keep your hair short. Use a mild shampoo and be gentle when you wash your hair. Also, avoid hair dryer, hair rollers, clips or bands, and do not color, dye or perm your hair. We offer workshops such as the Look Good Feel Better workshop to help patients cope with their self-image and improve their quality of life. Using a scarf, cap or turban is also an effective way to protect the head from sunburn and to prepare yourself for any hair loss. You can also buy a wig that matches your own hair color. It is important to notify the doctors and nurses on the side effects that you are experiencing so that they can monitor your progress with the treatment.
Many people have concerns whether chemotherapy is painful. Receiving chemotherapy by injection, orally, or on the skin is usually no more painful than taking any other medicine by these methods. However, your vein may become hardened or sore after repeated intravenous injections. Be sure to inform your doctor or nurse if you experience any pain or discomfort during or after injections or infusion. If you miss a dose of medication or a chemotherapy session, consult your doctor or pharmacist immediately. They can advise you on the most appropriate course of action. Do not take a double dose of medication to make up for any missed doses without specific instructions from your doctor, because it may cause more harm to your body.
Some medicine may interfere with the effects of drugs used in chemotherapy or may have unsafe effects too. So, it is important to inform your doctor on other medicine you are taking before starting on the treatment. you should always consult the doctor on new medicines such as over-the-counter drugs, traditional herbal medicine, and even vitamins while you're on chemotherapy. If you wish to consume alcohol, you should discuss with your doctor before consumption. Even if it is safe, you should do so only in moderation. Generally, there is no need to adjust your diet while you're on chemotherapy, but you may need to adjust your diet in the event that you experience certain side effects. It is safest to avoid raw or undercooked food such as sushi, raw meat, and runny eggs to prevent infection. A well-balanced diet and avoidance of oily and spicy food can also help in coping with some of the side effects such as nausea and mouth sores and can fight infections more effectively. It can also ensure that your body rebuilds tissues faster.
It certainly was not an easy period for us as a family. We had to make multiple trips to the hospital for the medical reviews and the many chemotherapy treatments. These were physically exhausting and emotionally trying. But we kept holding on to the hope that she was going to get better, and seeing her get better with each cycle of the treatment was definitely worth all the effort.
The most important part of fighting this cancer battle is to remember that you are not alone. There are many cancer survivors and support groups out there that are ever ready to lend a helping hand or a shoulder when you need one. We have been through this ordeal and we understand what it is like during this period. So we want to be there for our fellow cancer warriors. We hold on together. 加油!
I'm a survivor of stage 4 nose cancer, which is in 2012. I started my treatment in April and I ended in November. And the treatment was very tough and it was very stressed for me, and it's not easy, but I have faith in it. So I've gone through the 12th cycle of chemotherapy and 33 times of radiotherapy, which is it's a very tough period. And I vomited, I feel giddy, and I have to go for treatment by myself and without anyone who follow me. So I have to accept and continue my path and my future. So because I have 3 children, so I will not give up. So I move on. So here am I speaking to all the patients here to not give up and move on and have faith in it, because faith gives hope. I hope it helps all the patients.
NSIS also offers a range of supportive care programs designed to support you and your caregivers emotionally, physically, and psychologically. Our Health Resource Center, located at Level 10 of the NUH Medical Center, houses a resource library that is home to over 900 titles of fiction and non-fiction books, complete with cancer care and educational resources available for you and your caregivers. Also available at the Health Resource Center are massage chairs and complimentary internet access and movie screenings for you and your caregivers to occupy yourselves with while waiting for your appointment or loved ones. Our Health Resource Center also organizes supportive care programs such as the Living with Cancer Education Series and Kids Connect to provide you, your children, and your caregivers with the necessary and up-to-date information and skills to cope with cancer and the side effects of treatment. Other programs such as the Cooking Masterclasses, Relax Your Mind Yoga classes, and the therapeutic use of art making are targeted at easing your journey with cancer holistically, enhancing your overall quality of life. In addition, Cancer Line Nurse is a free telephone service operated by trained oncology nurses. It is an anonymous and confidential service that provides information and counseling on cancer-related issues for you, your families, and members of the public. The line is open from Mondays to Fridays from 8:30 a.m. to 5:30 p.m.
The duration of the entire chemotherapy treatment depends on the type of cancer you have, the goals of the treatment, the drugs used, and the response of the cancer cells, as well as the side effects you may have. Sometimes people have chemotherapy over 6 to 12 months, but it's possible to have it for a shorter or longer period. It is important to work closely with your doctors and to commit to the entire duration of the treatment. It may be long and it will not be easy, so the concerted effort by you, your family and loved ones, and your doctors and nurses play a big part in getting through the treatment.